Hey everyone, welcome back to theclinicaltrialsguru.com. Again, that website is theclinicaltrialsguru.com, and we're joined via Skype. You can hear her voice, you cannot see her today. Valentina Jaramillo. She's Colombian, but she lives in Argentina. She runs a very popular Twitter chat specific for Latin America and healthcare and social media. It's pound HCSMLA. Is that correct, Valentina?
Yes, Dan, that is correct. It's Hicksom LA to say it a little bit easier. And pues hi everybody. I'm glad to be here again.
And you also work with Investigación Clínica Latin America?
Correct, that's correct. We have a website. It's actually Investigación Clínica Latam. And right now we're working on an event in clinical research in Latin America, something different. That's going to be a big surprise, I think.
Okay. And we're going to put links to your Facebook page and to your Twitter profile and to your website. And we've done an interview with Valentina in the past. For those of you interested, we'll put links there, and also with a doctor she works with, Dr. Arabetti. We're going to put those links on as well. Today's chat is going to be on the short side. We're going to discuss, first of all, what Valentina's up to these days, and then we're going to get into a lot of social media and how social media can be used for clinical trials, specifically Pinterest, which is a hot topic of late. And Valentina and I were talking on Twitter several times about how Pinterest can be used to recruit study participants, or at least increase awareness. So Valentina, let's first get into how you're doing and what you guys are up to.
Okay, so right now with the Hicksom LA chat, we're planning on doing a Hicksom LA camp, right? Of getting together. The first thing that's going on, it's actually going to happen in Chile. It's called Viralizando, as in viralizing, right? And we're going to get together with the Pan American Health Organization and with the people from Matasanos, which is a blog, a medical blog. And we're getting together just to, I think, crowdsource more ideas about what social media how social media can help healthcare around this part of the world, right? We are also trying to have different people invited to the Twitch chat that are doing cool stuff in healthcare. One of them, it's called Incubando Salud, which is an idea from a university here in Buenos Aires to also kind of help startups in healthcare. They give them advice. They also do angel sourcing and everything for them. So we're trying to work with them to have several projects at the end of this year. So we'll keep you posted on that too. And with Investigación Clínica Latam, as I told you before, the idea right now is also working on how to get together in an event, something different for Latin America in clinical research, something kind of like having TED as the main idea, no? So where ideas can actually flow in the clinical research world, which sometimes gets a little bit the same, no?
Right. Now, just so the audience knows, because they may not have seen our first interview, what role exactly do you have in the clinical trials world? Do you deal with the patients, or do you deal with doctors? What exactly is it that you do?
I'm a CRA. That's one of the things I do. I'm a clinical research associate, and I also work with the regulatory part as a free consultant from time to time. And with the Investigación Clínica Latam, what we do is we actually have several courses for project management and to give sites an idea of how to run a real clinical trial site, no?
Mm-hmm.
In also in this part of the world, in Latin America. Right now, we mostly work with Argentina and Ecuador, but we're expanding all around the region, right?
Right. Now let's jump into social media because I know that's a favorite topic of ours. Um, what are some ways, for some of the audience members who may not know you? I know a lot of the Twitter people know who you are on Twitter, but what are some of the things you use social media for as far as clinical trials are concerned?
As far as clinical trials are concerned, we use social media, especially to make people know what clinical trials are. No,
Right.
there's a big myth around the clinical trials in Latin America. So what we try to do is keep them informed, show them videos with YouTube, or post different links in Facebook, in our Facebook page, in the Investigación Clínica Latam page. We also in the in the HICS-MLA Latam chat, the HICS-MLA chat, we also talk about clinical research so that people can ask questions and actually know what we're talking about when we say clinical research, right? To so we can take the myth away. It
Right.
actually works. It's because social media, it makes information available for many people that before didn't have it, and sometimes it makes it easier to find that information, right? It's just there on your Facebook page once you start following someone. So it has helped quite a lot.
Yeah, I know. We had last week. We interviewed a study participant who's doing a research study somewhere in Kansas, and we interviewed her along with the research clinic director at the same time. We interviewed them together, and I asked her. I said, "What's the first thing you thought about when you thought of clinical trials?" And she said, "Guinea pig." That was the first word she thought, and then the research clinic director explained to her what clinical trials are really about. So what you're using social media for is pretty much to do what that research clinic director was doing, but on a larger scale, right?
Exactly, that's our idea. That's exactly the idea. Trying to get the word out, no, to spread the word out so that that guinea pig myth, we get it over with, right?
Right, right.
Like, and people understand that they are actually doing a great thing once they decide to get involved with clinical research. That anyway, no, if you are a patient, be a participant, and all the benefits of being a clinical trial subject, and if also for doctors, no, for them to understand that being investigators, it's another good option for
Right.
the clinical practice.
Yeah, we deal with the same things here in the States as I'm sure you guys deal with in Argentina. There's obviously a similar stigma there as well, right? About people who join clinical trials, they're guinea pigs, and sometimes the physicians feel the same way. Is that correct?
Exactly. I think it happens all around the world, no?
Right. So what you're using social media for is actually very good. Now let's get into everyone's favorite hot topic of the moment, and that's Pinterest. Okay? And you understand why it's valuable. I understand, but I was talking to someone the other day. I'm not going to name his name. I don't want to embarrass him. But he's a prominent figure in the clinical trials industry. He's very involved in social media. And I said, why don't you do a Pinterest? And he said, well, it seems like it's just visual. Like, I don't know, how it can be beneficial to me. And I said, because it's so small, your message may be amplified there much more than it would be on Twitter or Facebook because there's less clutter on that page. That's kind of the advice that I gave him, and I think a lot of people are missing out, especially in our industry, because they hear Pinterest and they immediately think, well, this is not serious stuff. I'm just going to skip this. I'll just continue with LinkedIn and Twitter. And I think that's a big mistake. What are your thoughts on the whole Pinterest thing?
I agree with you. I think Pinterest makes it actually images make information come more clear to people. You can actually say many things to them or make them read But if you show them one image, it can say more than 1,000 words, no? Like
Right.
the proverb. If we are able to show people images that are powerful, and we are able to transmit our message about clinical trials and how it is important for patients to think about it as an option, I think it's going to be much easier to get the message through. So
Right.
maybe
Right.
it might be a little bit difficult to think about that image, maybe creating that image is it might be an effort, or it's oh, I forgot the word, but it might be hard for us, and we might need to be really creative and innovative. But once we create the picture, it's gonna make our message come right through. So I think we definitely need to think of Pinterest, have it in mind, and I don't know, if you look around Pinterest, you find many images that are powerful and that maybe you never thought they could transmit that message,
Right.
but they do. So
Yeah, and
I
I'm
agree
glad you
with
brought
you.
that up because, see, that's not even a biggest selling point for me, and I have to probably reevaluate that and start using images more. But what I use it for is the video, because they allow you to post videos on there too. So the way I see it is, it's like a smaller pond where you can still reach some people, because there's some people who I reach only on Pinterest that I would not reach on Twitter. I don't reach on Facebook. I mean, for whatever reason, I just interact with them on Pinterest, and I just joined about a week ago. Um, Now, I want to pick your brain a little bit when you say images to help reduce the stigma of clinical trials or whatever it may be. I'm trying to get some ideas. Like, what type of images do you think would be successful on Pinterest when it comes to clinical trials?
That's the challenge, no?
Yeah.
Definitely, we would need to brainstorm it and draw some stuff. But I think just out of my mind, when pictures are funny, like cartoons, or
Mhm.
trying to use something like that, to show. Right now, the only thing that comes to mind, right, is the patient happy from joining a
All
clinical
right.
trial.
Yeah.
But I
Yeah.
think the big challenge is taking that to the next level, no?
That
That
that could be a possibility. I enjoy the videos. I didn't know that you're allowed to post videos, but now, I mean, this video is gonna go on Pinterest, and I'm hoping it gets a lot of views there because it has the word Pinterest in the title. So people are gonna be interested, like, Pinterest and clinical trials. I want to learn more. They might click it. There's another strategy I've been playing around with. It's, our goal is to get people interested in clinical trials, obviously, right? But people want to interact with human beings. So I go in there and I'll post pictures about sports. I'll put things about music. I'll put books that I read. If someone finds that interesting, they may click on my profile and see clinical trials. Then I have the opportunity to engage with them on clinical trials, which otherwise I may have never done that if I'm not engaging with them as a human being as opposed to just clinical trials.
completely agree. Definitely a way for it to get more people involved, no? And using a completely different strategy, not
Right.
even telling them or addressing them with the clinical trial, no? Just with being a person, and
Yeah.
showing them your interests, and knowing, and people get to see that you are a real person and you actually like other stuff.
Right.
And it's true, it's happened, no? Once you see somebody, even not only in Pinterest but in Twitter also, when you see someone says something that you like, you
Mhm.
check their profile, and you probably find a completely different world from what you were expecting, no? From whatever they said.
Right.
So
Yeah.
it is, I think we need to use it. I think we need to explore it a little bit more, like finding out that videos can be pinned, and there's probably
Oh
a lot to
yeah.
it, no? And I
There's a
think
lot. There's
definitely
probably a lot of different, and especially when you get into therapeutic areas. Like, I don't use it for this reason, but if I'm recruiting for a depression clinical trial, and I go on Pinterest and I see people posting things related to depression, either, this picture makes me sad, or I feel sad when I hear this song. It gives me ideas about that person that, hey, maybe they have depression. I don't know. There's so many different ways you can explore with this, and I think, it's up to all of us to just kind of figure it out. But you definitely need to be on there and start engaging with people, not necessarily with clinical trials directly, but just as a human being. And I think that's something that I've seen you on there, Valentina, right? You're on Pinterest.
I am on there. I'm still exploring it to see what else we can do. I definitely think it's a valuable tool. We just need to. But another thing I think it's for it to be successful, that we need to have a clear focus of what we want to get at the end.
Right.
Not just use it without knowing, trying to we can explore it, and as you said, being a person, and you can share your interests, but at least know where you want to go from there, no?
Right.
Just because also just engaging with no point is also not worth it, no?
Right.
But I think it's powerful, and we shouldn't just discard it, no? We need to think as Pinterest as another helpful tool.
Right, yeah, it's just, and for the time being, when it's relatively small, it's probably the best time to get in there, because, to be honest with you, if you do a search on Pinterest for clinical trials right now, there's a good chance you're going to see my videos, and that may not necessarily be the case on other social networks. So that's just a random thought. And I know you're a big Shakira fan, so you can definitely engage people with the Shakira videos, right?
Definitely agree. No, there's a lot. I found lots of animal lovers in Pinterest, and really nice pictures. So you can find a lot of different stuff, and always engage with the people at the end. Yeah, I also like Pinterest connecting really easy to Facebook and Twitter, no? So that's another easy way to connect.
Right.
I think definitely a good tool to explore. And as you said, being there at the beginning makes it easier, no?
Definitely. And there's a lot of business applications to it too, outside of recruiting for studies. What if you're someone who owns a research clinic, and someone who's very influential with a study at Pfizer is on Pinterest? You can follow him, and maybe he's interested in a certain type of wine or something. Maybe you have something in common. It provides a way for you to interact with them, and then say, oh, by the way, we do studies over here. And it's definitely a good introduction, a good handshake to meeting new people as well.
Definitely agree with you, Dan. I think we can explore it a little bit more, and then find a lot of new uses for it, no?
Yeah, and we'll see as we go along, because it's very new. Valentina, we thank you for coming on. We're gonna do this again. I'll definitely check you out on Pinterest more to see what you're posting. And everyone follow the HCSMLA tweet chat. We'll have the links up there. And I gotta give a special shout out to our co-producer. Valentina, we have this list where people can register their companies or themselves as research providers, clinical research providers. Whether you're a monitor, whether you're a research clinic, or whether you're just like a consultant, they can register their profile. It costs $99 for the year, but the first 100 people to do it are gonna be given producer credits for our show for this year. And so we had our very first sign up today. It's only been out for like a few days. Sarah Siegler. So we're gonna give you a shout out here. Thank you for being a producer, and we hope more of you guys get on there. But Valentina, thank you very much for this interview.
No, Dan, thank you very much for inviting me, and please say I just wanted to say hello to Don also. I know he was not there with you, but I just wanted to say hello.
He's probably stuck in traffic, but I'll let him know. Thank you, Valentina.
Okay, bye.
This is Dan from theclinicaltrialsguru.com. Take care.